issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned. My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon Show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned.
On the first Friday in the month of October, we're in the 10th month of the year, and we are grateful to God for the gift of life. My name is Abena. Welcome you to Cradle to Crayon Show right here on Sunny 88.7 FM. We are live on Sunny TV. Check out our Facebook page, Cradle to Crayon Facebook, and also Sunny FM Facebook page. We are live there. And also our YouTube page, we are live on Cradle to Crayon YouTube page. You can join in the discussion, whatever comment, whatever suggestion, you put it there. We say thank you to our sponsors, Back Specialist Hospital and Fertility Center, Rohi Children's Clinic, and also to Secure Sanitary Pad. Now this morning I have here the acting programs manager. It's a program for immunization from the Ghana Health Service. I want to talk about a campaign they launched a couple of weeks ago, and from next week they are rolling it out. This is the HPV vaccination. Want to know what this entire campaign is about and who this is targeted at, and also to encourage mothers to allow their daughters as they come around the schools, the centers, to receive this vaccination. For this campaign, in the long term, is aimed at reducing cervical cancer, which happens with the second leading cause of related cancer death in women. So the campaign is right, encouraging our mothers to allow our girls to do this. But before then, we want to pick a spot of message from our sponsor, Rohi Children's Clinic. The time Dr. Abnashi talks about cancer. We'll be back.
Think cancer is just for adults? Nope. Kids can get cancer too, you know. But the good news is that there is hope. Most childhood cancers are curable if caught and treated early. So watch out for these signs: a white spot on the dark part of the eye, or lumps or bumps anywhere in your kid's body, including the tummy. Or if the child gets sick frequently or turns suddenly pale, or if the kid is bruising or bleeding very easily, it could be a sign of cancer. If you notice any of these, don't wait. Get the kid checked out. Early detection saves lives. Share this to spread awareness.
By Rohi Children's Clinic. Now at Rohi Children's Clinic, children receive more than treatment. They receive full attention in a caring atmosphere. Their services include specialized care for disease of babies, children, also for adolescents. There's well child clinics, laboratory services, health screen, and also school health service for new entrants and continuing students. They are ready to serve you from Monday to Friday. The time is from 8 a.m. to 7 p.m. And on Saturdays, they are open until 2 p.m. Locate Rohi Children's Clinic at Reeds Junction at Denta, or call them on 0200 342 960 or 0592 053 234. Their website is www.rohicc.com. Rohi Children's Clinic, experience total care. Now visit Back Specialist Hospital and Fertility Center for all your fertility, maternal and general health concerns. They have services include IVF, IUI and other fertility services. Also do child health and pediatrics. There's women's health and gynae, obstetrics and maternity, internal medicine, general OPD care, inpatient care, the surgical service, also theater service and laboratory and ultrasound scan services. Locate them right here in Accra. They are in Taifa. Or call them on 0558 862-292 or 0592 196003. Back Specialist Hospital and Fertility Center, integrity and excellence in healthcare. Our WhatsApp line is 0540 130 684. My guest this morning is Dr. Selom Kuchwati. She's the acting programs manager, expanded program of immunization with the Ghana Health Service. Dr. Selom, good morning.
Good morning.
It's good to have you here, bringing the big woman here. It's good to have you here to talk about this entire campaign. Yeah. First of all, what is HPV?
HPV is a virus, human papillomavirus, and it's a very common virus. It's so common that we expect that most people who have sexual intercourse by 25 years would have already had it. About 80% of them would have had it. It's actually not just spread by sexual intercourse, it's spread by close personal, close skin-to-skin contact. But we know that sexual intercourse is probably the ultimate way of having close skin-to-skin contact. And it's a virus that there are various types. A lot of them don't do anything, but there are a few that cause problems. Some
of them are dormant, they are just there.
They are just there. Or let me say, we have not found what they cause.
Okay.
But there are some that are what we call highly oncogenic. They cause cancer. And then there are some that cause other conditions. So the ones that are of highest concern to us are the ones that cause cancer. And that's 16 and 18. That's the highest. They cause about 70% of cervical cancers. Okay. There are other types, 30, 33, and other. They also cause cervical cancers, but to a much less degree. And then we know that these cancers, not just cervical cancer, let me just add, it causes cancers of the throat, so the head and neck cancers. It causes cancers of the anus and the penis and also the vagina. So these are things that happen with HPV.
Okay. So with this vaccination, why this entire vaccination? What's the purpose for this HPV
so we found
vaccination?
That HPV causes cervical cancer, and we found that cervical cancer is the number 2 cause of cancers among women. In fact, about 3,000 women would get cervical cancer every year, and of those 3,000, about 80% of them would die in a very short period, because by the time they are diagnosed with the cancer, it's already quite advanced. So it's
because they don't come in early.
It's a combination of 2 things or factors. One, we're not picking it early because early cervical cancer has no symptoms. Okay. So by the time you start seeing the symptoms we see, which is like abnormal vaginal bleeding, that is bleeding in between your period, excessive bleeding, maybe you've gone on menopause now, you started having bleeding again, or you have sexual intercourse and you have bleeding after, or you start having a discharge which is more than normal and starts to smell bad. You may also have abdominal distension as well. You may also have pain on sexual intercourse. There are various symptoms, but by the time this comes in, you have already reached about stage 3, stage 4, which is already quite advanced. And
there's no indication at the early stage.
At the early stages, nothing comes up. You only find out when you go and screen. And typically, when you even detect that you have cervical cancer at an advanced stage, then we have issues of money. Because you have to do various tests. You may have to do a biopsy to be able to tell that it's a cervical cancer. You have to do other ancillary tests to see what the state of the other organs are. They have to check if it spreads to your other organs. Then you have to go on to radiotherapy, surgery, and all those things. And it involves money. Some of those things are covered by insurance to an extent, but the bulk of it, money is an issue. So people may have the symptoms and stay home because they don't have money. So it will not start early. So by the time you see it, it's already late, but they also don't have money to go. So you wait till things are out of hand before you go. Yeah.
What if some also they have zero knowledge on cervical cancer? There's no education on it. Then the rural areas, they don't even know this is what I'm dealing with.
That is also a big factor, because we found that for the more educated, they go for the screening. So we advocate that you have at least 2 screening in your lifetime, one at 35 and one at 45. So the educated women are able to go out and do the screening. Of course, the screening isn't free. So there's also a little barrier there. So you need to be able to pay for the screening. You go and get the screening done. If you do there are types of screens that are done. They have the visual inspection with acetic acid, and then there's a pap smear. So the visual inspection one, when they do the test, they'll say that the place looks white. Okay, then they'll ask you to go and do new tests. if you do a pap smear, that's when they'll see the cells and see that there are abnormalities, and then you can go on to possibly treatment. And then there's HPV DNA tests, which can be done with a pap smear. So even if they don't see anything there and the place looks normal, they can still test and see if you have HPV there, then that will mean that you may need a more frequent testing to see if there are any abnormalities and catch it early. So these women you are talking about are not going to have these tests. So they would come in late. The educated women, rather, they come in quite early and they don't die. Because once they come in, they have the means to be able to get the test done, any further test, they have the means to be able to navigate the health system to get treatments. But it's quite unfortunate the burden falls largely on those who are not able to afford.
Okay. So to avoid all these pap smear, all these tests, and then they dying, that's why you're introducing this vaccination.
Yes.
Now, what's the age bracket for this?
We are vaccinating girls aged 9 to 14 years. So with the vaccination, doesn't mean you will stop the pap smear.
Okay.
What we are saying is that you will take the vaccination to prevent about 70% of cervical cancers. As I said, there are another 30% that are caused by other things. Because cervical cancer, other things that can cause it include alcohol.
Alcohol?
Yes, alcohol causes cancers.
Okay.
Smoking also does a similar thing.
Yeah.
So those are all things that can also, so if you've vaccinated but you're still doing all these things, you can also go and get the cancer. Also, I mentioned to you that there are other HPV viruses that also may cause cervical cancer, but to a much lesser extent. So you may have taken the vaccine all right, but you are engaged in high-risk sexual behaviors. For instance, you started having sex early, or you have multiple sexual partners, or your sexual partner has multiple sexual partners. So basically, you are having sex with many people. Yes. So other things can also lead to it, but they are to a much extent than the vaccination. So we still push that even after the vaccination, you still get the screening done.
Okay. For this age bracket, said 9 to 14. Why that age? Is it because of menarche? For what reason are you just putting only those girls, doing it for just these girls?
So the vaccination is available to everybody in the country. Anybody in the country can take the vaccine. However, for our program, we are targeting girls aged 9 to 14, and that's because research has found that these are the girls who have the maximum benefits for the vaccine. So they produce the highest immune response, such that when they take the vaccine, when they in future come into contact with the HPV, they don't get infected because they have produced a lot of antibodies. As we grow older, the response wanes down. So even at my age, I won't say my age here.
I know.
At my age, if I test and I'm negative, I can go ahead and take the vaccine. Because I'll still benefit from
the cost yourself.
Yes.
Okay.
So those outside my special year age group, that is 9 to 14, you can go and take the vaccine, but you have to pay for it in the private sector.
Okay. For these girls, how are we doing it? So I want even to find out. You're saying girls. I know boys also get HPV related diseases, boys and men.
Yes.
Why are we taking the boys out? Why is it just the girls you are looking at now?
So for now, we are looking at targeting cervical cancer, which affects women. We do know HPV virus affects other males as well. And in some countries, in fact, the vaccination is gender neutral. So boys and girls get it. But for now, because we are targeting HPV causing cervical cancer, we are starting with girls. We hope that as the program goes along, we will definitely look at expanding to boys as well. But what we know is that if we immunize the girls, the pool of circulating HPV will even reduce. So
because there are more girls than boys?
No, not that. Because those who are susceptible to get the HPV and spread have reduced. So the amount of HPV that will be circulating will reduce. So the boys too will get protection. Even though it's not direct protection, they'll get secondary protection if we have enough girls immunized.
Okay. Are there some girls who cannot receive this vaccination?
Yes.
Who are still in the age brackets?
Yes. So if a girl is pregnant, she cannot receive the vaccine. If she has had any allergic reaction to any HPV vaccination in the past, she cannot have the vaccine. Also, if a girl is seriously sick, we will also not advise. In fact, we will not give the vaccine to anybody who is sick.
Okay. When they come in, do you do some tests, you do some counseling, you talk to them, want to ask questions before you do, or just go straight ahead once you are here, you are just doing the vaccination? Let's do it and get over, because there's a long queue waiting for us.
No. So what's happened is that we have our staff on the ground. They are visiting all the schools. So even before the exercise, we've gone to schools and they are still going to schools. They meeting the students, and what happens is that, this group, they are very curious, adolescent group. They are a very curious group. They have a lot of questions. So we've met them, we've tried to ask them, interacted with them ahead of time. And then also we have interacted with parents. So there are PTAs that are ongoing. Our staff are meeting the parents as well. We are meeting them at various places, churches, organized groups. We are even here. And I know you are going to open the phone lines for people to ask questions. Yes. So we are doing various interactions such that as many questions as possible can be asked here now. And when the vaccination starts, it's not going to be line up and inject you like we are in the military. No. What's going to happen is that before you take the vaccine, definitely we'll ask you, you ask, do you know what you are coming to take? They show it to you. Do you have any questions? You get the opportunity to ask questions before they give it to you.
Before they give it to you. Well, it's just 15 minutes on top of that. I have here Dr. Salom. She's acting programs manager, expanded program of immunization with the Ghana Health Service. We're discussing HPV vaccination. We say thank you to our sponsors, Bath Specialist Hospital and Fertility Center, to Royal Children's Clinic, and also to Secure Sanitary Pad. Our phone lines have been open. Number to call is 0540 130 684. 0540 130 684. It's the same WhatsApp line. Send us a WhatsApp message. My doctor here will answer you. The whole campaign is end product is to prevent cervical cancer.
Yes.
What type of cancer is it?
It's a cancer of the cervix. That is the entrance to the womb. And looking at where the cervix is, it's not somewhere that's, let me say, it's a very private part.
Yeah.
Because we normally say maybe the vagina and the vulva are private parts, but the cervix, you have to actually go and look for it to find it. So it's a cancer that's, in a way, it's a bit of shame and stigma around it, because for somebody to be able to detect, they have to definitely,
invade your privacy.
Invade your privacy, quote.
Yeah.
And it's as I said earlier, it's quite common. It shouldn't be, but it's quite common, and it's something that we realize that's affecting our women. And there's a lot that can be done. In fact, it's one of the few cancers that we know are largely preventable. Yes, because we found the virus that causes most of them. So when you're able to vaccinate girls against this, you know that in the future you have a cohort of girls who will not be able to get cervical cancer. And in fact, Denmark has done a lot of work on this. They've almost fully eliminated HPV in their population, because they have been vaccinating for a long time.
Okay. Is that data to show, because over the years the numbers are coming down, or rather having more women reporting? You said that you don't pick it up early. Women are coming later with their cases, or numbers are going down, or you are treating less women and then fewer women are dying. Is there data to show?
Actually, it's the reverse. The women are actually going up. There's been work that has gone on to show that if Ghana, for instance, does not do anything about it, in the next 20 years, we'll probably have more than a 4-fold increase.
Wow.
Because we are, let's also, 4-fold increase. So if this year we are having, let's say, 3,000 cases, 3,000 times what? 4.
That's going to be 12.
Yes, that's a four-fold increase.
Okay.
And that is going to be, these are women that are most likely in their how do you call it, their productive age. That's somebody's mother, somebody's sister, somebody's wife. And every woman who gets cancer, it has repercussions for not just herself but her family. So it's important that at this time we all come together to look at what we can do.
Let's pick this call. Hello, good morning.
Hello, good morning.
Yes, your name, where are you calling from, please?
Okay, I'm calling from East Lagos.
Great. Let's hear you, sir.
Okay, so beautiful submission and presentation by the doctor. But like you asked, why are they focusing on that particular age bracket for girls? And I think the question you asked about why the focus is on the girl child, fine, yes, it's a valid reason, and also with the fact that the boys will be secondary protected. But isn't it also be nice for us to also add the boy child, so that we have maybe like a double layer or like a 2-factor authentication to show that, yes, let's also vaccinate the boys, let's not leave it to chance as well, and say, okay, once we vaccinate the girl child, the boy child will be fine. So why don't we do both, so that the both gender will understand that two of us have to be safe, instead of one being safe for the other. So that is my question to the doctor. Thank you.
Okay, thank you so much, sir. Thank you. Yes.
So he wants 2-factor authentication.
Yeah.
Okay, so I've mentioned that the vaccine, actually, if you are a male, you can get the vaccine in the private sector. For now, as I keep emphasizing for now, because we are starting from a point. So for now, it's for girls. But I know that in the greater plan for HPV vaccination, the plan is to make it gender neutral. But I cannot say that it's going to be tomorrow or next year. It has to start for us to see the rollout, then we can extend. But if you're a man and you want 2-factor authentication now, you can go and do the test and then go and pay for the vaccine or pay for your son.
Okay. Before then, you're talking about the numbers. I mean, as the numbers going up, now?
Yes, the numbers are going up, and it could be a factor of two things. One, we are getting more cases, and also two, because noise is being made, people with these symptoms are not staying home like they used to again. Because sometimes you come to hospital and the person has come at an advanced stage. In fact, let's trigger warning. When I was a house officer, I did housemanship in Kolebu, and I remember there was a woman who was brought from the Volta region, and she came in with advanced cervical cancer. So we used to have a corner of the ward. We used to put those cases, and we have a corner with a fan blowing on them, because the stench that they were exuding, it was very bad. And you can imagine, there's somebody's mother. So imagine what was happening with her at home. Nobody will come near her, and then the nurses will come and they will come and spray, and everybody should they'll buy Dettol and bind and things. They are mopping, they are spraying, and yet you know that they are in the corner there. When you enter the ward, you can smell that there is something offensive here, and you can imagine even the mental health toll on this, because if you are a woman and you have this offensive smell, I'm telling you that no amount of treatment would help you. You probably die from the depression alone, because that is a very serious thing. So we think that at this point we cannot continue to let these things happen. I'm sure if you take a visit to any of the hospitals that treats cancer, you will definitely meet women who are going through this, and it's not a good thing to go through. We are doing a lot for breast. Breast doesn't have a vaccine. I'm sure if breast had a vaccine, every woman I know would line up to go and take the vaccine for breast cancer. But currently we don't have a vaccine for that. But we have a vaccine for cervical cancer. That's what we have now. So I think it's good that we arm ourselves.
Are there risk factors for developing this?
Cervical cancer.
Yeah.
So I think I mentioned them a bit already. Early, having sexual intercourse early. That usually means that you may end up having more sexual intercourse. You also have women with multiple partners, women who are sleeping with people who are having multiple partners as well. Drinking alcohol, smoking as well. Those are all common risk factors. And then underlying all this is the HPV virus. That's the big underlying thing. So HPV is in fact an almost necessary cause to have cervical cancer.
I'm sure there are some misconceptions out there. Reason why some parents are not willing to allow their girls. Some would think that is some sort of family planning. Because once I give them the vaccine, it prevents you from getting this. So the girls can leeway to then go and have sex all over. Have you come across some of these things?
In fact, these things are things we've heard, and these are myths that we are still working on. So I'll start with the family planning thing. The vaccine has been in use for 19 years. And next year is, in fact, the 20th year of the vaccine we are coming to administer being in use. And in Ghana, we've run...
why now? Did I find out why now? 19 good years. So
yes.
Why now?
Why now? So Ghana has done pilots. Our first pilot was in 2013. In fact, we've done 2 major pilots on this vaccine, the acceptability, the feasibility and things. Before we do all these things, there's a lot of work that goes on underground, because you need to find out whether the population is ready to take it. You need to find out how feasible it is. And this involves economic calculations and all this. So a lot of work has been ongoing. It's just as now that, let me say, the stars have aligned. So financing moves with acceptability, moves with vaccine supply, moves with cost. A whole lot of things have aligned, and so this is a good time for us to bring it into the country. And as I said, we've had a pilot for over 10 years. In fact, when the vaccine was being piloted in Dodowa, I was then I won't tell you. If I tell you, I'll give you an idea of my age. I used to work in Dodowa at that time. I was a medical officer there. And in fact, there was a lot of noise. When they first started, people were very hesitant. But after a day or two, they realized that when they inject us, the girls, they're not dying. And they are bringing their girls.
They're going to die.
Yes, but that's the Ghanaian thing. Anything they're coming to inject, the first thing is, they don't want to kill us. White man wants to kill us. Population.
Yeah.
But some of these girls we vaccinated, they are there now. And we had a documentary that when we met some, and they were able to talk about their experience with it. That's about 12 years down the line. Some of them have had children. So the vaccine does not affect fertility. And if it did, a country like Denmark will not put it into their national program for them to have it this much, because all those countries, they are thinking of ways to boost their population. So they wouldn't bring in things that would reduce the population. And also, our vaccine is not going to ask girls or boys to be promiscuous. I think that there's a bit of a disconnect in our system where we still have some of the morality or the values that we have. We espouse them, but we don't practice them. So we all say we don't want our girls or boys to be having early sex, but the reality on the ground is that a lot of parents shirk their responsibility, and the children are doing all these things. So we are not saying that come and vaccinate so you can go and have sex, because our vaccine only protects against HPV. If you go and have sex, you end up pregnant. You may end up with the other STIs, the other ones that will lead you to losing your fertility. HIV, you can even get that through sex.
Yeah.
So the vaccine is not going to tell you, we're not giving it to you so you can go. It's not a license to kill.
Yeah.
We're just telling you that we want you to be protected. So when you are ready to have sex in a responsible way, you will not get HPV and then subsequently get cervical cancer.
Okay. Should parents be worried about some adverse effects after they receive the vaccination?
Okay, so let me first start by saying that the vaccine has been registered by FDA for about at least 10 years in the country now. So parents have actually taken the vaccine a lot in the private sector. They've given their children. In fact, I know people who have paid for their children. Yesterday, somebody was telling me that she paid over 3,000 per shot. So she was very sad that after she has paid, now it's now coming to become, it's going to become free because she has had to pay
3,000, eh?
Yes, per shot. But she's paid. She paid because of course she knows the benefits.
Yeah.
So she knew that it would be very important. Once her daughter turned 9, she went ahead and paid for it, and now it's free. So she's a bit pained.
So for her, she can't take it again.
No, she can't take it again.
Okay.
So the vaccine has a good safety profile. What we found is that the common side effects we have are that because of adolescent girls, they tend to be a bit, in quotes, histrionic. Anything that touching them, oh, I'm going to faint. I feel a bit drowsy. I'm feeling itchy. Sometimes you have pain at the site, and that's obviously because it's an injection. So you have pain.
Where would it be administered?
It will be administered on the arm.
Okay.
So you have pain at the site. You may have some heaviness. You may have a bit of swelling. Some people may report headache, maybe abdominal pain, dizziness. But let's know the age group, because that age group, even drawing their blood is a problem. So you've seen
drama.
Adolescent girls getting blood drawn. It's like a whole drama. Ooh, they're lifting their arms and things. So those are things we expect.
Okay.
And what we are saying is that if you go and take the vaccine and you feel that there is anything untoward in your body, we're not waiting to say you've collapsed somewhere before you go. If you feel you even have headache, take your card and go to a public health facility and take your card and tell them I took the vaccine.
Proof of vaccination.
Yes, I was vaccinated on this date. This is my proof. Please, I'm not feeling well, and they are to take care of you for free.
Okay.
So as much as we know that the side effects are minimal, and these are the ones I'm typically talking about, we are not going to leave it to chance and say that when you have headache, stay home. If you feel you have headache, go and let them see you and then show them your proof that you've been vaccinated.
Okay. For girls who, for whatever reason, are not able to go to the vaccination, what happens to them? We didn't even talk about when is it starting? Which date next week?
So we start on Tuesday 7th, and we're starting with what we call a campaign, which is more like an aggressive push. So we are moving to schools, we are moving to the community. We are actively going to seek out the girls now, which is why we are doing so much work now. So the parents and the community know that we are coming. So we won't just appear there with our code boxes and then we'll be asking, hey, who are these Ghana Health Service? We want to tell you what we are coming to do. So we are going to do the 5-day campaign. After that, it's going to be available in the routine immunization. So what we call the weigh-in. Anytime you walk into any of those weighing centers with your child turns 9, you can just walk in and tell them, my child has turned 9, I have proof, my child has turned 9. Then they immunize them.
They'll do it for them. Our time is up already. You have any closing comments, last words? I mean, encourage parents out there who are so skeptical that this is safe, this is good. You need to come in and vaccinate your young girls.
I think you said it all. Please, our parents, please bring our girls to come for the vaccine, and it's going to be a one shot, so it's not, you don't need multiple courses, it's just a one shot, it's one and done. So please, let's take our girls and get them vaccinated. It's very safe, and that's why I said we also have provision that just in case you don't feel like you are tip top after it, go and then we'll take care of you for free. Please, let's get the girls vaccinated, because in fact cervical cancer is a very debilitating disease, and it's very sad. It has effects on the family, not just the woman herself, the children, the parents, the siblings, everything. And it's a big blow to us if we sit down and allow a preventable cancer to afflict more women. Thank you.
Thank you so much, Dr. Salam.
Thank you.
And I will say thank you to our sponsors, back specialists, to Rohi Children's Clinic, and also to Secure Sanitary Pad. I want to take this moment to say my sincere condolence to the family of Yesuto. We are laying to rest tomorrow, to the family Bewono, and also to the husband, Mr. Mauli Amedofo. We are praying that during this trying time, God guides you, gives you the strength as you go through this. Yesterday's service was lovely, and we are looking forward tomorrow as you come to the church to lay her rest. So we say, may her soul rest in peace. Don't forget, tomorrow same time will be a repeat broadcast on Sunny TV. Have a good working day and stay blessed. Bye-bye.
My name is Abigail. I'm the host of the Cradle to Crayon Show on Sunny 88.7 FM. Starting this February, join me on Sunny TV as I bring to you the Cradle to Crayon Show every Friday morning from 9:30 to 10 a.m. I host gynecologists, pediatricians, pediatric nurses, clinical psychologists, midwives, speech therapists, and so many as we discuss on issues pertaining to women and children, even the family inclusive. Don't forget, it's a Cradle to Crayon show right here on Sunny TV every Friday morning from 9:30 to 10, and a repeat broadcast on Saturdays from 9:30 to 10. We'll talk on issues that you want to hear about your children and issues on women. Stay tuned.